Have you ever had a vulva itch? Now imagine this, you're out grocery shopping, at work, at school, or just casually out with your friends, and you have this irresistible urge to scratch. Sis, I come bearing good news. So I've come to tell you today that you are not alone. And before anyone pulls that hygiene or promiscuity card on you, watch this. Hi guys, welcome back to my YouTube channel. My name is Edidion Udoekon. I'm a public health specialist and health educator. On this channel, we talk about health and wellness tips. And today I have this big smile on my face because I've been spoiled. Thank you so much, my returning subscribers. And if you're coming across my video for the first time, please like, share, comment, send a link to your friends and ask them to do the same. Thank you so much. I'm eternally grateful. Now, today, let's get right into business. We'll be talking about vaginal itch today. Possible causes, what you can do at home when you are supposed to see a doctor. We'll be talking about it today on this channel. So please stick with me. Let's go. This topic is not often talked about because people feel embarrassed, ashamed to talk about it. And most often than not, the hygiene card will be pulled on you. Hygiene, promiscuity, you know how people do it. So it's not often talked about. Well, we have to talk about it, yeah? That's why we're here anyways. Having a persistent vulva itch is called pruritus vulvae. I'm sure you'll be wondering if it's my previous video that inspired this particular one. Yes, it is. I just thought, why not talk about it? Because, people shy away from talking about it, so we're here. So I'll be telling you why our vulvas itch, possible causes, things you can do to manage it at home, and when to see a doctor. Now, our vulvas itch for a lot of reasons. The first one is it's a warm environment. It's warm, it's moist, and you know what happens in warm and moist environments? Things tend to bloom. Another good reason is, you know how we are as women are always trying things, trying things. You hear your friend is selling this particular insertable, you buy it, you try it. Bath bombs, harsh perfumes, they tell you it's going to smell like a flower, you bought it already. And a lot of other reasons which I'm going to mention in this video. Persistent itch can be caused by a number of identifiable causes. For example, STIs. STIs like genital herpes, that's blister-like cold sores. They cause intense itching, especially at night. Also, Trichomonas vaginalis too. Actually, it causes intense itching at night. If we also have pubic lice. Now, pubic lice, they live on the skin, they burrow under the topmost layer of the skin, and they feed off of blood and lay eggs. They cause intense itching. They are nocturnal pubes. They cause intense itching, especially at night. Now, the good news is it is treatable with topical off-the-counter meds. It's very treatable. Non-STI causes like scabies can cause itch. Scabies appear on the skin, especially in the web-like portion of your fingers, but they can get like all over your body. They cause intense itching. They are mites. They burrow under the skin and lay eggs and cause intense itching, especially at night. Scabies is treatable and can be treated with over-the-counter topical creams. The next one on my list is threadworms. What are threadworms? Threadworms are found in feces. They look like tiny bits of thread. Even though they're found mostly in kids, they affect people of different ages. They can cause intense itching, you know, a kind of close neighbor thing. So if you do not wipe well, you can actually introduce them to your vulva and it can cause intense itching at night. Threadworms are also treatable with over-the-counter medicine. The next one on my list is candidiasis. That's yeast infection. Yeast infection causes it usually presents as presents with cheesy vaginal discharge. It doesn't really have a smell, and it itches mostly at night. Now, it is estimated that at least 75% of women will experience vulvar vaginal candidiasis in their lifetime, and out of that, 10% will see a doctor because of this reason in their life. Vaginal candidiasis is also treatable. It's a fungal infection. It's not an STI, it's fungal, and it gives persistent itch at night. The next one on my list is irritant or contact dermatitis. You can get a vulvar itch if your skin comes in contact with harsh perfumes or chemicals. This makes it to itch, like all those perfumes and all those harmful practices you do, like belching, can cause a persistent vulvar itch. Irritants like soaps, fragrances, wipes, scented toilet paper, bath bombs, bubble baths, and a host of others can dry out the skin around the vulva and cause an itch. Detergents, fabric softeners, lubes, and even condoms can dry out the skin of the vulva and cause an itch. When the skin becomes itchy, it hardens up with time, goes tough and hardens up, like naturally forms a thickened layer. This is called lichenification. Another non-STI reason why you itch down there could be psoriasis. Psoriasis is a chronic inflammatory condition that is characterized by scaly patches on the skin with closely marked borders, evidently marked borders, and it's also itchy. So a generalized itch like psoriasis can cause a vulvar itch, may be responsible for a vulvar itch. If you have psoriasis, you should see your dermatologist. Ingrown hairs can cause an itch. Even folliculitis, a complication of ingrown hairs, can get infected and then cause other problems for you, including an itch. Chronic scratching of the skin can cause it to be inflamed and in turn cause more itching. This is known as lichen simplex, and there can be like a variety of others, lichen planus and lichen sclerosis. Persistent scratching can lead to inflammation and then lichenification, like I explained earlier. So and there is a little % chance that if you have lichen simplex, you can get skin cancer. Hormones can cause a vulvar itch. Yes, you heard me right, hormones. Fluctuations in hormones during pregnancy, breastfeeding, and menopause can cause a vaginal itch. That is why when you're pregnant and then you develop an itch and you get to the hospital, sometimes they just send you home with relief creams, topical creams to just relieve the itch. It's fluctuation in hormones at the time because of the pregnancy that is causing the itch. Also, I like to state that vaginal itch, vulvar itch is not a condition, it's rather a symptom. If you have a bowel condition that causes leakages, smearing, or any other form of incontinence and directly comes in contact with the vulva, you can actually get an itch. If you do not wipe down properly too, you can get an itch. Some conditions that give generalized itch can also give you an itch down there. Also, some diseases like chronic liver and kidney disease can also give you an itch. If you also have diabetes, and some medications can also give you an itch down there. Psychological problems and stress can also trigger a vulvar itch. Now, what do you do if the itch persists? Your itching is likely to persist If whenever you itch, you scratch, you just keep scratching. Now let me explain. When you itch and you scratch, you cause inflammation. That sends signals to nerve endings that in turn cause you to itch more. Now when you itch, what are you supposed to do? When you itch, it's always advisable that you do not scratch. Try as much as you can. You can pat or rub, but do not scratch. And also, you should keep your nails really short to reduce the damage. You should keep your nails really short to reduce damage, because when you have long nails, and you tend to cause more damage. When you scratch, the cycle continues. You scratch, it gets inflamed, the nerve endings send signal, and then you get more itching. Also, you can do well to avoid harsh perfumes, detergents that you use to wash your underwears. Do not use harsh products. Do not use soap. But at least for the meantime, soaps dry out your vulva. Dryness causes itch. You can use gentle cleansers, feminine washes, emollients, but for the time being, do not use soaps. Try as much as you can to avoid tight-fitting clothes. Avoid tight-fitting clothes and synthetic fibers, especially for your underwears. Then if it gets too uncomfortable at night, you can actually take antihistamines. I was going to say sedative antihistamines, but most antihistamines are sedative. Like in the other video I mentioned loratadine. Usually if you're prescribed loratadine, you're advised not to take it and drive. You should take it at night, mostly because it causes this drowsy effect. It makes you sleep more. So antihistamines can actually alleviate nocturnal itching. For disclaimer's sake, I am not advising you to self-diagnose. If you have a persistent itch, especially if it is accompanied by a number of other symptoms like a foul-smelling discharge or a generalized itch like the ones I mentioned, like scabies, psoriasis, please see a doctor for tailored prescription, for like tailored diagnosis and prescription, the one that suits the severity of your case. That's it for today, guys. Thank you for tuning in, and I hope you learned something. Have you experienced this? Did you have any weird experience out in public with this condition? Please, you can share your experiences in the comment section. Thank you for stopping by my channel. Please subscribe, like, click on the notification bell, and send this video to your friends. Thank you. I'll see you next time.